It's the taboo subject that nobody wants to deal with. You know, working with a nationally known hospital who prides themselves on hope, you know, a cancer support hospital, or a cancer hospital that prides themselves on hope. None of the physicians there would ever have end-of-life conversations. When I worked there, that's all I was doing. So, I mean, you know, it gets a little ridiculous after a while that we all know first aid, but nobody seems to ever know last aid. There are more nurses than physicians. If nurses are ever going to take the lead in this industry, that has to be the reason why we do it. We all take these journeys, but then physicians seem to always fall off when we get to the point where, you know, where they say, well, there's nothing more I can do. We stay on. We should stay on. I stay on. There is a beauty to that flight. There really is. And I've been with over 500 at the end. So I can tell you there's a beauty to that flight. There's a purpose to it. And knowing what I see and what I've been through with each one of them, it's easy for me to take that step with these patients. I became a DNR in 2008 because sometimes it's rather difficult to get a patient to do a DNR. But if you can walk the walk, it's easier to get them to do it when you've done it. So now it's a lot easier for me to get them to follow me if I'm willing to take that road with them. And I feel that nurses, you know, I mean, we do the ultimate sacrifice. We advocate for them. You know, a physician will first do no harm, and that's their thing. But we're the ones who advocate. So we have to know how to take that last aid with them. And I think that that's the ultimate goal here. And everything is trending toward palliative care now. You know, there's incentives that the government's giving physicians and, you know, to sign people up for it. This is where it's going. And there's no downside to it. You know, if you think that this is the only life there is, well, then that's a shame. But I know that there isn't. You know, so I see no downside to either one, to fighting or not fighting. You know, that's how I look at it.